I decided to make an entrance, and then I'm gonna twirl around because we thought we'd have fun at Summer Skin Rescue. Hello, everybody. We're gonna try and keep this relatively short, 15 or 20 minutes, but Summer Skin Rescue has started, and this is our big virtual open house. It's actually the 4th year that we've done this. And it is our best savings of the year in terms of all the devices that we do, and then a lot of the injectable packages. My name is Dr. Melanie Palm, if you haven't met me, and I am here with the amazing, amazing Kristi Cashman, who is our non-invasive body contouring specialist. So we thought we'd review a couple things in this room. Right now we're over in the body suite, so this is where we do things like cool sculpting and EMface and EMsculpt NEO, all the things that help cellulite, fat reduction, help with muscle toning. And right now, she has become like the guru of San Diego in terms of EMface, which is a new technology that we have. What exactly does it do?
So EMface is going to help tone the muscles in the face and also enhance the ability of your skin to make collagen and elastin with the radio frequency here. So these applicators are delivering muscle contractions and radio frequency to the skin.
And how many sessions is it normally, Kristi?
So normally, it depends on the age of the patient and the amount of aging they have going on. But your average patient under 50, I would say 4 treatments, and then over 50, I usually do at least 6.
Awesome.
And we've been seeing fabulous results with this.
Yeah.
Nice little lift in the brow, some tightening along the jawline, softening of the nasolabial folds, and a little more fullness and just volume in the cheek area. So it's been beautiful.
And what I think I like about BTL technology is when they actually debuted something, they've done phenomenal research on it beforehand. So this is, like Kristi was mentioning, it's muscle toning for the face, and then the radio frequency helps with collagen and elastin production. So what I really like is we get so many requests for patients wanting to sort of do rejuvenation, but do it in a natural way. And I love this because we've never had something to address the muscular compartment short of surgery. And so this is a way we can tone the muscles, build the muscle tone back. It's almost like they're slings that become more elongated over time. And many of these muscle groups we're treating, they're holding in the soft tissue and it drops over time. So we're helping to lift. So in the clinical studies, there were improvements in the brow position, improvement in the shape of the cheek, the depth of the nasolabial fold, and then improvements in the jawline and some of the jowl formation. It's been an excellent sort of combo treatment to Ultherapy in the lower face and neck. We're going to preview that next. And then for a lot of my injectables patients, you know, we never want to overfill a face. We want to facially balance, but there are I think this is a way, short of surgery, for us to sort of redrape the skin and help lift the skin. So I've had it done myself. I remember going to our American Academy of Dermatology meeting. I'd had my first series of treatments, and some of my fellow lecturers and faculty members are like, "What are you doing to your face, Melanie?" And I really credit EMface. Kristi just treated me with a maintenance treatment. So you know, it's been studied now up through a year without retreatment, but what we're telling patients, similar to muscle toning on the body, we want you to do some level of maintenance. So it's usually a series of treatments, 4 to 6 of them. It doesn't hurt. It feels like sort of just your muscles contracting and a little bit of a warm heat sensation. But really ask us questions. Kristi offers complimentary consultations. Right now with the special, we're buying, you buy 5, you get the 6th free. So,
it's 4.
Or is it 4?
Yeah, 4
okay.
you get 2 free.
Yeah, so
yeah.
Take a look at our blog entry. It clarifies that, but you get a total of 6, and it's a nice savings. So with that, we'll turn to some of the injectables. If you are doing one of our body contouring, either fat reduction, muscle toning devices, we are offering topical products as a part of that package. So Body Transform is something that's been shown to build collagen, build elastin, and actually help if we are trying to remove fat. It actually helps accelerate some of the fat loss. So small set of studies have shown it reduces the fat just by using this topical by 30 to 50%. So if you're doing cool sculpting, if you're doing EMsculpt NEO and trying to reduce fat, even when I'm doing liposuction, this is part of what we give patients to really enhance the results. And And then we are offering filler packages. So we have a package where if you buy 2 Radiesse, which is a calcium-based filler that I use a lot for facial rejuvenation, it's FDA approved for hand rejuvenation, you get a Bellatero free. And this is a hyaluronic acid filler. It's great for fine little lines, so I use it around the mouth for fine lines. We sometimes use it for tear troughs. I use it for tech neck lines. Radiesse I commonly use for the jawline, for the lateral face, for neck rejuvenation to build collagen there, and for back of the hand. So that's really nice seller. And along with that, the product that you get for free is an elastin product, and this is their best sellers kit. So you get their amazing pro mineral sunscreen. You also, along with that, get the skin complex, that's the recovery complex, and then you get a little itty bitty sample of one of their newer products too. So that's a great way to preview, I think, a really premium line of skin products. So we're going to leave Kristi and going to leave the EMface room. We're going to go to our next technology. As I was mentioning, I love EMface for sort of facial toning. Well, nice combo treatment is to use ultrasound in the lower face and neck to help lift. So one of our in-house resident experts is April Brinkley, who's one of our PAs here. And she, tell us about, you're going to Miami in a short period of time.
Yes.
Because you're so excellent at Ultherapy. So tell us about that.
So in 2 weeks, I got the exclusive invitation for the company that makes Ultherapy. They're responsible for this technology. I got a special invite to go to do even more advanced and master training. So I'm really excited about that.
Yeah.
But basically, I love this procedure. I love doing this procedure on my patients because it really does offer something that a lot of the other modalities and tools that I have can't offer, and that's lifting up the tissue. So I like to treat the chest area for those chest wrinkles, for some of us that have a lot of sun damage or they're side sleepers. This neck area is beautiful. So neck rejuvenation is something a lot of us are concerned about. So I'm able to treat the neck, this submentum, where we get that loose and kind of saggy area. As time goes by, the cheek, I can lift up those cheeks, and especially the brow area. We can get a nice lift of the brow with this device, which is basically just targeting that fibromuscular tissue that's responsible for keeping our skin up nice and tight. So we treat it with this micro-focused energy, these ultrasound lines, which we know is completely safe to do to treat the tissue. And that will just in turn, in about 3 months or so, we'll see a lifting of that tissue. And the results last about 18 months, which I think is, you know, a really nice timeline to get out of a one-time treatment. There's no downtime whatsoever, which my patients love that. They can come in, get it done, go back to work that very next day. And then also we don't have to think about any risks involved with surgery.
Yeah.
So that's pretty cool.
And I think by popular demand, because so often we're doing Ultherapy lower face and neck treatment, and then EMface up top, that's a new addition. So we actually have a special this year, lower face and neck, but you can save on full face, you can save on full face and neck, as well as chest offerings, I think we may have. It's a great procedure. What's so neat is you can see the screen up here. So when April is actually deploying some of this focused ultrasound to create heat energy and new collagen growth in some of these tissues that allows the lift, we can see in real time. So that's really what differentiates, I think, sort of an average Ultherapy user from one that is driving the boat that is really expert. And I definitely put April in that category. You know, she's looking at the screen in real time so that we're targeting the 2 tissue compartments that provide the most amount of lift. So very popular, you know, treatment. You certainly can talk to our 2 PAs about that if you're interested in it. And I think what's nice is we offer sort of 2 different ways to receive the treatment. So if you don't want to have any downtime in terms of how you feel after the treatment, we can give you just some oral medications and topicals, but many of our patients, I would say 70%, do what I call Margaritaville, and we give you some medications. You need a driver, but it just makes the procedure so palatable. We've often gotten the compliment that patients have had Ultherapy at another center, and when they have it done here, it's a real breeze and just a totally different experience, and I really credit April and Stephanie to making patients comfortable, walking them through things, and just being such experts at anatomy that they're really targeting the right tissues. We're not wasting the energy, and we're really capitalizing on the ability of Ultherapy to lift the skin and build new collagen over time. So we'll leave this room in just a second, but I wanted to mention that if you are doing Ultherapy, we are providing a free Revox line relaxer, and this has got neuropeptides in it. So this has been shown in clinical studies where they combined it with a neurotoxin. It actually elongated some of the response from doing something like Botox or Dysport around the crow's feet area. There's actually a newer study that was done out of Japan that showed if you use it on the full face, there's a 44% increase in the improvement of pore size. So it actually decreased pore size over time, made skin appear sort of more glassy and sort of even toned. So I actually have been using it on my full face in the morning for about the past 9 months or so. So it's part of my little secret Dr. Palm sauce that I put on my face in the morning. But it's so nice that we've been able to give patients, if they are doing Ultherapy, I think this is an excellent complement. You could either use it around the eyes as it was intended, or now we understand probably full facial application has some benefits as well. And then along with that, one of our most popular injectable product packages is Sculptra. So Sculptra is polyolactic acid. It's actually manufactured from non-GMO corn and beets. It comes to us as a powder. And I treat this, and so does Stephanie and April as well. This is an injectable product that stimulates collagen. So it's a collagen stimulating agent. So I love it because we can harness the body's own ability to build collagen. We use it on the face, but I use it a lot off the face as well. So we can use this as a complement to the Ultherapy. We can treat the décolleté area. We use it on arms. We use it on buttocks. Knees, thighs are also popular areas. And so we are offering, you buy 3 of these, you get 1 free. And similar to some of the other injectable packages, you're getting that nice little combo of the elastin injection set. So that's really nice to have that sampler so you have exposure to that product. So I want to thank April for all of her expertise. We're very excited that she got such an elite opportunity to train and learn even more in Miami. So I bet she's probably going to teach people stuff because she's such an expert. But we'll leave April with her Ultherapy patient. We're going to move on to the next room. So in this next room is a newer technology that both April as well as Stephanie are doing. So Stephanie, who's our other PA, we're going to actually show her doing some of this procedure itself. And we'll maybe have her stop for a second just so we can talk, because this is actually really loud machine, even though it's not scary. But we're doing something called microneedling with PRF. And you might ask, like, what is PRF? I've maybe heard of PRP, which is plasma-rich platelets. But PRF is really neat in that it doesn't have an additive. So when we're doing PRP, where we take a sample of blood, we spin it down, and we use this to help sort of capitalize on all the platelets and growth factors to help act as kind of fertilizer when we're doing microneedling. PRF, we don't add anything. So it's a slower spin to the blood. We get all the yummy platelets we do from PRP, but we also get the fibrin network, which houses a lot of the growth factors, which are kind of like fertilizer for the skin. And then about 2% of the cells are mesenchymal cells, so they can help differentiate into healthy skin, healthy fat if we're actually injecting it. But I think something, we get a lot of asks about doing technology during warmer weather months, and are there safer things that I can do that don't elicit so much heat in the skin? And microneedling is certainly one of these. So we do topical numbing for an hour. Judy is our beautiful model. And we've just started the procedure. So we do topical numbing. It doesn't hurt. It feels like maybe scratching the skin or a little bit of just mechanical rub. And then you'll see as she goes along, and we'll stop in a second so you can actually see the procedure. I'll be quiet. She's actually got the PRF, which is this sort of light pink color. And she's actually, as she's going along with the microneedling, we're depositing some of that PRF into the small channels that the mechanical disruption from the microneedling itself is causing. And so we usually do several passes. Both Stephanie and April do a ton of this. I think there's not a day that goes by that the ladies aren't doing at least one of these on their clinic schedule. And it's done as a series of treatments, so pretty minimal downtime. We end up using a hyaluronic acid product called HA Immerse Serum, which I think we're gifting to people with this sort of cycle, or we're doing a series of 3 microneedling. So if you buy 2 of these microneedling with PRF, you get the 3rd for free with Summer Skin Rescue. And then we're also providing the HA Immerse Serum, which is the topical that we like you to use afterwards. In terms of recovery, people are just a little bit pink for a few days, sometimes a little bit of swelling. You can start to wear makeup 24 hours afterwards. But this is a great procedure with minimal downtime, and especially for darker skin types, patients with melasma, where others sort of lasers, light treatments, energy-based devices, we need to be so careful about not aggravating their pigment. I think this is an amazing option. And we often will combine this. So I love IPL and ResurFX, but we'll do this. So we'll do microneedling and PRF and alternate it with IPL ResurFX. So that way we're kind of mechanically disrupting and giving you some of your own fertilizer and then doing something with light treatment afterwards. So I want to thank Steph. I don't know if you have any sort of like, I know you've been doing a ton of it. What have you been seeing in patients?
Oh my gosh, I think this is a super popular treatment in terms of like acne patients that are dealing with acne scarring, and patients who just want an overall improvement of their skin quality and texture. It helps with fine lines and wrinkles, and helps reduce, minimize the appearance of your pore size. So it's an awesome treatment, as Dr. Paul mentioned, for all different skin types throughout the board. At all ages as well, and it's all natural, especially with this PRF that we're using. I think the recovery time is a lot faster now that we're using the PRF, and we're just getting such great results. So it's awesome, really high.
Thank you. One of our in-house PRF microneedling experts. And then we'll also talk about injectable specials. So as I mentioned, we're actually providing patients with hyaluronic acid products, so they have that with the microneedling and PRF. And another one of our popular packages is the Restylane package. So we actually have Restylane Contour, which is typically used in cheeks and sometimes chin, Define, which is approved in the lower third of the face, but also FDA approved for chin augmentation, and then Restylane Kiss. What we're really sort of excited about is I was actually one of the principal investigators for both Restylane Contour and Restylane Kiss. So we were like 6-7 years ago actually helping with the studies that led to FDA approval for these products. So I think that's why I choose to do this research, is we have expertise coming out of the gate when many of these products are getting FDA approved. And what's nice about the Restylane package is you buy 3 Restylane, you get 1 free, and we can mix and match. So you can use Restylane Classic, we can use Restylane Lift, we can use Kiss, we can use Contour. It's a really nice package, and it's a great way to sort of offer savings to so many of our patients. And then along with the other injectables such as Sculptra and some of the other packages that we've been offering, you also get this bestsellers kit, so you get to preview some of the Elastin products as well. So we're going to move and move on from our microneedling and PRF. Thank you so much, Stephanie, and thank you, Judy, for being an amazing model. And we're going to move on to just some of the final examples. So we have one more technology to show you, and we can't forget the men of Art of Skin MD. So we're going to talk about something called EMsculpt NEO. So we demonstrated EMface for the face and muscle toning. This is kind of a cousin and equivalent that we use on the abdomen and the flanks. We can use it on the buttocks, we can use it on arms, we can use it on thighs. And this helps build muscle and reduce fat. So on average, across many clinical studies, it's been shown EMsculpt NEO with a series of 4 treatments to reduce the fat by about 30% in the area of treatment, and to help build muscle mass by about 25%. So I actually do this periodically on my abdominal area, or Kristi administers it to me, and on my buttock area, because those are opposing muscle groups that help with our posture. And I'm a tall physician, I'm leaning over people, and it helps me not only have stabilization in my core, it's got aesthetic benefits, obviously, that's, one reason that we're doing it. But I notice it with my workouts, my yoga is easier, my Pilates is easier, and my day is easier. So we've had many patients anecdotally say when they treat their core area, that lower back pain is improved. We've had patients that have returned to things like running that they hadn't done in 10 or 15 years. And you can see, as we're doing this on our male model, you can actually see his rectus abdominis muscles, which are his vertical muscles, actually being stimulated, and then there's radio frequency that is simultaneously being deposited through that handpiece, so it's gently heating up the fat compartment so we can reduce some of the fat in that area. So what's the most common combo treatment that you're doing, Kristi, in terms of the abdominal area?
I love doing, I love adding cool sculpting to the mix. Cool sculpting I love to do to reduce a little bit of volume. So if somebody has any pinchable areas on their tummy, I love to get rid of that with cool sculpting, and then topping it off with some EMsculpt NEO to just reduce the the volume a little bit more, but also to really strengthen that core and pull that abdominal wall back in. We also have the edge applicators that we use on the waist, which helps to cinch that little waist in too, which is beautiful after cool sculpting as well, or on its own. And then with men, a lot of times we'll use the 2 applicators. We're just doing one for demonstration purposes today, but it gets a little more intense with the 2 applicators. And for men who tend to get a little bit of a tummy as they get a little bit more mature, this helps to again bring that abdominal wall back in.
And so it's usually a series of 4 or 6 treatments. It's
done
usually
once a week. Yep.
And then I myself, I try and do one quarterly. I think it depends on patients. There's been studies that have shown at 12 months, MRI studies, that people still maintain their muscle mass, but I tell them it's like going to the gym. It's better if you're periodically doing things.
Absolutely.
And then interestingly, there's new research, imaging studies that have shown that doing this, probably because we're reducing fat, building muscle, it's helping with sort of how our body speaks to itself. We are actually reducing our visceral fat, which is the fat that encompasses all of our internal organs. And it's not a direct effect from the device itself. It's because we're sort of helping build muscle and reducing fat that we're actually seeing a reduction in this really unhealthy fat that's, you know, a higher risk for things like cardiovascular disease. So I think there's so many functional benefits. There's newer studies that show it prevents sarcopenia, which is our reduction of our muscle mass over time. When we lose muscle mass, we lose balance, and it really affects quality of life. It's a huge thing that we really need to be thinking about. So having good muscle mass is so important, and I like this so much for the aesthetic benefits, but I like it just as much for the functional benefits and the quality of life benefits as well. And similar to what we were talking about with cool sculpting or some of the other body sort of devices that we're doing, we are offering that transform. This helps reduce fat. If we're using it in areas we're trying to reduce fat, so in the abdomen, we're trying to do that. And so you get a full size of the body transform, and that'll help enhance some of the fat reduction that we see with patients with this device. So we're going to leave EMsculpt NEO. So we've got a preview of that in the abdominal area. And then finally, we're going to finish up with some of our raffle packages and a final injectable package. So we've gone through a lot. There's great information if you go to artofskinmd.com and go to our blog. Our most recent story goes all over the specials. There's links to some of the different procedures. And then there's also pricing information. Our phone lines will be off until 1 p.m. Pacific Standard Time, so we'll be back on air, I think, in about 20-30 minutes or so. But just wanted to go over a few final things. You know, we talked about PRF, so something that has become quite popular that we're offering some savings with is a little spin on PRF, where we will take a sample of blood, half of it we spin slowly to get PRF, and the other half we spin really quickly to get something called PPP, or platelet poor plasma. And then we combine those two things together and you get easy gel. It looks a little bit like autologous fat. And so we use this commonly in the under eye. We can actually get above the orbital rim up to the lash line. We can use it as a quote unquote kind of injectable filler in other areas. So I'll often use it in the brow area. April and Steph have been doing a ton of it in those areas and using it in the lower face to help with quality of skin as well. So this is the first time we've had it. We've introduced it to our practice about 7 months ago. It's been a wonderful complement to sort of pan-facial Sculptra, and then we're able to use this in areas that we can't inject Sculptra. So we are offering savings this year with this. We are offering a couple of raffle prizes. So this is an amazing kit of some of our best sellers from Art of Skin MD. We also have a kit of Neo Cutis, which is a growth factor line. And then finally, we have some things from Isden, which is melatonic and an amazing sunscreen from Isden as well that I love, that has a DNA repair enzyme. So if you want to get one of the raffle prizes, if you will please tell us what is your favorite procedure or what you're looking the most forward to doing here at Art of Skin MD, that'll enter packages that I wanted to talk about. So we are offering 15% off of all of our skincare if it's non-prescription strength. And if you spend $300 or more, we are actually giving away some of our Color Science sunscreen. So you get this amazing sports stick with $300 or more. So it's always nice to save a little bit and also get something in exchange. So we've got, while supplies last, I think we have 100, and I know we've already been selling some of those packages. And then finally, our last injectable package, in addition to the the Radiesse Sculptra package and then the Restylane package, is we're also doing a package with Juvederm products. So this includes things like Voluma, Juvederm Ultra Plus, Juvederm family. Again, you can mix and match. We offer a buy 3 of the products, you get the 4th one free, and this can be used for all sorts of applications, typically on the face, to help with sort of support and some of the structural changes that happen with time, or just to enhance the beauty you already have. So we want to thank you guys. This is our 4th year doing it virtually. It's been quite a hit. It's always nice to do these Instagram lives and for you guys to see what is sort of new and being previewed at Artist Skin MD. So thank you guys all for attending. Please comment on what your favorite procedure or favorite thing is that you're looking forward to doing, or that maybe you've done and you'll be entered into our raffle. We are going to be running this open house this week, and it ends next week on Friday. So just make sure once we're here from 8:30 to noon and 1 p.m. to 5 on Pacific Standard Time, you can call us. We will help you with packages and we can get you booked for things. So thank you all. Hope you guys are having a great fall, and thank you again for joining us for some of our skin rescues. We'll say goodbye to our amazing staff. Kristi, April, and Stephanie, thank you guys so much for your expertise and doing an awesome demo. And we look forward to seeing your shining faces at Artist Skin MD. Thanks, guys.